March 4, 1918. Just before breakfast, Private Albert Gitchell shuffled into the hospital at Fort Riley, Kansas, complaining of fever, sore throat, and headache. The Army cook felt miserable, his temperature spiking to 104 degrees Fahrenheit. Within hours, over 100 of his fellow soldiers reported identical symptoms: chills, body aches, splitting headaches. By the end of the day, the camp hospital was overwhelmed. What seemed like an ordinary flu outbreak was actually patient zero in the deadliest pandemic in human history. Within 18 months, the virus would circle the globe, infect 500 million people, nearly 1/3 of the world's population, and kill an estimated 50 to 100 million. In the United States alone, 675,000 Americans would die, more than all American combat deaths in World War I, World War II, Korea, and Vietnam combined. The world had never seen anything like it, and neither the cause nor the cure was understood. The timing could not have been worse. The United States was deeply entrenched in World War I, shipping tens of thousands of young soldiers across the Atlantic every month to reinforce Allied forces on the Western Front. In March 1918 alone, 84,000 American troops sailed for Europe, followed by another 118,000 in April. They traveled in cramped troop ships, slept in overcrowded barracks, and fought in muddy trenches. Perfect conditions for a respiratory virus to spread. The influenza that struck Fort Riley quickly jumped to other military installations. Similar outbreaks erupted at Army camps and prisons across Virginia, South Carolina, Georgia, Florida, Alabama, and California. By May 1918, the disease had traveled with American soldiers to Europe, where it tore through military forces on both sides of the conflict. 3/4 of French troops fell ill, along with more than half of British forces and over 900,000 German soldiers. Despite its name, the Spanish flu almost certainly did not originate in Spain. The pandemic earned its misleading moniker because of World War I censorship. The Allied nations and Central Powers suppressed news of the outbreak to maintain wartime morale and avoid providing intelligence to the enemy. But Spain, which remained neutral during the war, had no such restrictions. Spanish newspapers freely reported the devastating effects of the flu, including the illness of King Alfonso III himself. When 8 million Spaniards fell sick in the summer of 1918, international media picked up these uncensored reports, creating the false impression that Spain was the epicenter. Spain protested the name, pointing fingers at France and claiming the disease came from the battlefields and blew across the Pyrenees on the wind. But the misnomer stuck. The exact origin remains debated to this day, with theories pointing to Kansas, France, China, or even British Army posts. But most evidence suggests a North American source. What made this pandemic truly terrifying was not the first wave, which was relatively mild, but what came next. The initial spring 1918 outbreak caused disruption, but relatively few deaths. About 75,000 flu-related fatalities in the United States during the first 6 months, only slightly higher than typical seasonal flu. Most patients recovered within a week. By June, case numbers were declining, and many believed the worst was over. But in late August 1918, the virus returned with a vengeance, mutated into something far more lethal. The second wave emerged almost simultaneously in 3 major port cities: Brest, France on August 22nd, Freetown, Sierra Leone on August 24th, and Boston, Massachusetts on August 27th. From these epicenters, the deadly strain spread like wildfire. Within 4 months, it circled the entire globe, reaching Europe, Asia, Africa, South America, and even remote Pacific islands. This time, the virus killed with shocking speed and brutality. What began as ordinary flu symptoms, sore throat, chills, fever, quickly became something nightmarish. Patients' lungs filled with fluid, their skin turned blue from lack of oxygen, and they literally drowned in their own bodily fluids. Some victims bled from their noses, mouths, and ears. Doctors described autopsies revealing lungs so saturated with blood and fluid that they resembled red currant jelly. The disease could kill within hours. People who felt fine in the morning were dead by nightfall. Hospitals reported patients arriving with mild symptoms who collapsed and died in the waiting room before they could be seen. The speed and ferocity were unprecedented. Medical professionals, many of whom had witnessed the horrors of battlefield medicine in the trenches, were stunned by what they saw. The pandemic defied every expectation about who should be vulnerable to influenza. Typically, flu kills the very young and the very old, those with weak immune systems. But the 1918 strain displayed a unique and terrifying pattern that came to be known as the W-shaped mortality curve. Yes, infants and the elderly died in large numbers, but so did healthy young adults between the ages of 20 and 40. In fact, people in their late 20s experienced the highest death rates. Scientists now believe this occurred because the virus triggered a cytokine storm, an overreaction of the immune system that turned the body's strongest defenses against itself. Young, healthy people with robust immune systems paradoxically faced the greatest danger. Pregnant women were particularly vulnerable, with mortality rates approaching 50% in some studies. The virus didn't just kill the weak, it slaughtered the strong. Philadelphia became America's deadliest city during the pandemic, a cautionary tale of what happens when public health warnings are ignored. On September 18, 1918, the first case was reported at the Philadelphia Navy Yard. By the next day, 600 sailors were sick. Despite mounting evidence of a deadly outbreak, city officials refused to cancel a massive Fourth Liberty Loan Campaign rally scheduled for September 28. On that unseasonably warm autumn day, 200,000 Philadelphians packed the streets in a patriotic celebration. It was the largest parade in the city's history, and it became a super-spreader event of catastrophic proportions. Within 72 hours, every bed in Philadelphia's 31 hospitals was filled. Within a week, 4,500 people were dead. The morgues overflowed. Undertakers ran out of coffins and raised their prices by 600%. Bodies were stacked in homes for days, sometimes weeks, waiting for burial. Some bereaved families were charged exorbitant fees and then forced to dig the graves themselves. The city's healthcare system collapsed under the weight of the crisis. 26% of Philadelphia's physicians and an even larger percentage of nurses were overseas serving with the military. The doctors and nurses who remained were quickly overwhelmed, and many became sick themselves. Visiting nurses walked into apartments to find scenes from medieval plague years, entire families dead or dying, infants crying beside deceased mothers, husbands dead in the same rooms where their wives had just given birth. One nurse discovered a woman who had delivered twins 24 hours earlier, while her husband lay dead beside her. Her only food had been an apple within arm's reach. Hospitals converted streetcars into makeshift hearses. Schools, theaters, churches, and saloons were shuttered. Philadelphia lost nearly 13,000 people in a matter of weeks. By spring 1919, the death toll reached 12,191 out of a population of 1.7 million, roughly 1 in every 140 residents. The city's mortality rate in 1918 was 955 deaths per 100,000 people, more than 300% higher than the previous year. America's indigenous population suffered disproportionately. Native Alaskans were devastated, with entire villages wiped out in days. In the Alaska Native village of Brevig Mission, 72 of 80 residents died over a 5-day period in November 1918. Survivors were too weak to bury the dead, and bodies were left where they fell until rescue teams arrived. Urban areas nationwide faced catastrophe. New York City buried 33,000 victims. Boston, Detroit, Milwaukee, Kansas City, Minneapolis, and St. Louis all experienced staggering death tolls. Across the country, hospitals were overwhelmed. Doctors and nurses fell sick or died, and entire communities ground to a halt. Schools closed for months. Businesses shuttered. Public gatherings were banned. People wore gauze masks in the streets, though these provided little actual protection. Cities tried desperate measures, gargling with salt water, spraying mysterious anti-flu substances from pumps, wearing bags of camphor around their necks. None of it worked. By the time the pandemic finally subsided in 1920, it had fundamentally changed the world. The virus may have mutated to a less virulent form, or perhaps the majority of the population had developed immunity through exposure. Deaths from influenza in 1921 returned to pre-pandemic levels, though waves of illness continued to flare sporadically. Pennsylvania alone recorded 350,000 cases, with 150,000 in Philadelphia. The final American death toll is estimated at 675,000, representing 0.64% of the total population, roughly 6 out of every 1,000 Americans. But these numbers may be vast underestimates. The virus hit communities where deaths were never officially recorded. Many deaths were attributed to pneumonia rather than influenza, even though the pneumonia was caused by the flu. The true toll may never be known. The pandemic left a profound legacy. It killed more people in 18 months than the Black Death killed in 4 years during the 14th century. It killed more people than the entirety of World War I. It disrupted societies, orphaned children, destroyed families, and traumatized an entire generation. Yet, strangely, it was quickly forgotten. Unlike wars or natural disasters, the pandemic left no monuments, inspired few memorials, and disappeared from public consciousness within a few years. People wanted to forget the horror, but the virus itself was not forgotten by science. Researchers spent decades trying to understand what made the 1918 strain so deadly. In the 1930s, the H1N1 influenza virus was isolated in laboratories, beginning the path toward a vaccine. During World War II, the first flu vaccines were tested on American soldiers. In the 1990s, scientists retrieved tissue samples from victims buried in the Alaskan permafrost, including from Brevig Mission, and successfully sequenced the 1918 virus's genome. This research revealed that every influenza A infection since 1918 descends directly from that deadly pandemic strain. Today's seasonal flu is a distant, mercifully less virulent descendant of the virus that terrorized the world in 1918. Modern flu vaccines, antiviral medications, and advanced medical care have dramatically reduced mortality rates, but the threat of pandemic influenza remains. The 1918 Spanish flu stands as a stark reminder that invisible microscopic killers can be more